right? And that's an indication of a positive test. Okay, we'll pop that. Second test looking at the medial plica, special test, is called the plica stutter test. So you have the patient sitting and you start them in 90 degrees of flexion, and then you put your hand kind of over the patella and medial side where that plica is. And then what you do is you have the patient slowly extend their knee. And then as they're extending their knee, and then back down, and you can have them do that a couple times. As they're extending their knee, you're looking for the patella to maybe pop or kind of stutter at 60 to 45 degrees. The next special test is called the Noble test, and with the Noble test what we're doing is we're looking at iliotibial band syndrome around the lateral femoral condyle. So it'd be an overuse syndrome. The test is performed by having the patient sitting, and then what you do is you want to put your finger, your thumb, over the lateral epicondyle, and then what you want to do is slowly extend and flex the knee with pressure over that lateral femoral epicondyle. And if the patient has a symptomatic iliotibial band, they'll get pain, especially at about this 30-degree range right here. This test can also, you can also do this test with the patient supine, so sitting or supine. And again, it's a passive test, so I'm moving the patient's knee, the patient isn't moving themselves. We're going to look at a muscle length test, especially focusing on the quadriceps muscle. So in order to test the muscle length of the quadriceps, we can use what's called the heel to butt test or Eli's test. The patient is prone, and what you want to do is passively flex the knee until you feel resistance. All right, and you can ask the patient, you know, where do you feel that resistance? And typically what they'll say is the front of the thigh. So that way you'll know it's a quadricep tightness that they're feeling. And then in order to quantify this, you can measure how far the heel is away from the butt. So you can take a goniometer and just kind of measure that distance, and then document it and set your goals based on that distance.